Welcome once again to Action for Animals. Today we get the expert lowdown on proper pet care from veterinary surgeon Dr. Michelle Bell. Over the last few months, we've been sharing critical information that every pet parent or custodian should know, would like to know, and let's hear from the specialist in the field, shall we? What they look for, what you should look for, and hopefully, if time allows, we get an opportunity to answer a couple of your questions. But first, let's visit with Dr. Bell in her clinic, and then after that, here in the studio.
Hello, I am Dr. Michelle Bell. Today we're at Central Vet South, and we're going to talk about the importance of vet checks. So you want to make sure that you check your animal for certain things, your pet, and also that you take your pet to the vet routinely to get certain things done. For instance, vaccination should be done once a year. For puppies, there's actually once a month for the first 3 to 4 months, and then it's yearly. Same thing, similar situation for cats, but you can talk to your vet about the schedule for cats. Worming must be done routinely as well, more often for puppies than for adults. Also, there are certain things that you should be checking for routinely to make sure your pet is healthy. So I just have a little stray boy here, and he's looking for a home. He was found on the street. And I just want to show you the things that you would look for as a pet owner, you know, to alert yourself of maybe something might need to be checked. So you want to check the eyes and make sure there's no heavy discharge on the eyes. Check the teeth. They should be, you know, white to off-white. No big heavy buildup on the teeth. No big green, yucky, hard stuff on the teeth, and it shouldn't smell really bad. If it does, if any of those symptoms are there, you need to get your pet checked by the vet. Perhaps a dental procedure may need to be done. You look at the ears. You want to see that there isn't a whole lot of heavy wax buildup in the ears. You don't want to see pus, anything green, any liquid leaking out. And the pet should not be in discomfort when you touch the ears. If it is in discomfort, there may be some pain and maybe there's an infection going on. Also, you want to inspect your pet between the toes to make sure there are no ticks. Ticks also like to go in the ears, so you look between the toes to see if there's no ticks. You can also check under the tail. You know, just look around to make sure that there are also no fleas.
We'll continue with our visit with Dr. Bell after the break. On Action for Animals, we team up with the animal rights advocacy group, Action for Animals Barbados, and we're simply seeking to enlighten, to inform, in a little way to entertain, you know, but it's not light what we're talking about. These are sentient beings, and we need to know how to look after them correctly. They feel hurt, just like you and I do. So let's continue with our visit with Dr. Bell.
Now, ticks are bigger usually than fleas, but ticks can vary in size because they go through a whole life cycle, and you can have baby ones to big ones looking like raisins. And then you can have very small ones that look like fleas, but the difference is that fleas move quickly, whereas ticks don't move that quickly. So when you see something attached that's small and black and you can't really move it, it's probably a tick. If it's something like racing through the fur, like you look here, you see it, and then you look again and it's gone, that's a flea. Fleas usually cause itching, whereas ticks don't generally cause itching. But both of those parasites suck your pet's blood, and you don't want to have them on the pet. They can also carry diseases. So you should speak to your vet about monthly prevention for fleas and ticks to prevent your pet from having these parasites. So me as a vet, what I would be looking for, similar things like what I just told you when I'm doing a vet check. And we do vet checks whenever the pet is having a vaccine. It's not just a vaccine, we're also going to examine your pet to make sure there's nothing that looks alarming and that the pet is healthy. So we would be looking at the eyes, make sure there's no infection. We would be looking at the teeth to make sure that the teeth and the gums are healthy. The ears, we would actually probably take an otoscope and look into the ear canal, and we would look to see whether there's an infection, whether there's ear mites. I would also want to listen to the pet's chest to see if I can hear a normal heartbeat, whether the lungs also sound normal. I would also want to take the pet's temperature. Sometimes I don't take a temperature because the pet might be very agitated, and if so, I don't want to make the pet uncomfortable and, possibly bite me or the owner. So in a situation where, it's obvious that the pet is healthy and I could tell that there's no fever, I'm probably not going to take a temperature. All right, so that's how we take the temperature. We also would check the nails to see if they're extremely long, if they're curling back into the paw pad. We will also check to make sure there's no skin disease, infections, rashes, that sort of thing. And, glands, we would check to make sure the glands of the pet are normal. And that's pretty much an exam in a nutshell. There's one more thing that you want to check on as a pet owner. You want to make sure that your pet is not too skinny or too fat. We generally talk about body condition. And with body condition, you want to make sure that when you put your fingers on the rib cage, that you can feel the ribs easily, but you can't actually see them. You don't want to see them that you could count them, but you could feel them easily. You don't want to have a rib cage covered in layers of fat and you can't even tell the ribs are there. That means your pet is overweight. Also, when we're looking at the pet from up to down, we want to see that there's an indentation behind the rib cage. We want to see that there's a tuck under the abdomen and there's an indentation here. That it doesn't just come straight down, meaning the pet is too fat. Because having an overweight pet leads to health issues, leads to liver disease, pancreatitis, issues with arthritis, etc. So you don't want your pet to be too skinny or too fat. And sometimes, we love our pet by giving all these treats and all this extra food, and the minute we were eating something, we give the pet some. But then over time, they can be gaining weight and you're not aware of it. So if you use these little tips, the rib cage, make sure that you can feel the ribs but not count the ribs, and that you have a waistline. Those are general guidelines for making sure that your dog is not too fat. Similar, you don't, also want to see bones sticking up. You don't want to see the spine or the hip bones sticking out when you look at the pet. That means that they are too skinny, they're not getting enough nutrition, and you need to up that food. And let's just touch briefly on food. You can use commercial dog food. There's so many different brands. They're available in all supermarkets and pet stores. That comes in a dry form, in a pelleted form, or canned form. You can also use cooked food for your pet. You can mix it with the dry form of the kibble, or you could mix it with the canned food, but just avoid giving bones, especially cooked bones. But I mean, if you're not knowledgeable on how to feed the pet in terms of bones, avoid them completely, because it can lead to constipation, or it can lead to some bones being stuck in the intestine, and then you have to have some expensive surgery to have them removed. So it's safest to stay away from bones, but you can use cooked food for your pet if you're doing some rice and chicken or rice and beef without the bones. Even some vegetables, that's fine. If you can't afford to give the dog chow, you can do the cooked food. But try to do at least a 1 a day multivitamin for your pet, just to fill in the gaps for any nutrients that might be missing out. So that's, in a nutshell, how you would ensure that you're being a good pet owner. If you have any other questions, you must always not be afraid to call any vet clinic, and they should be more than happy to give you information on pet care.
Today we're looking at the correct care for our animals. Let's put it that way. Correct care. We've heard over the weeks, depending on the type of animal you have, some of the ways. But let's get the expert opinion right now. So let's welcome veterinary surgeon Dr. Michelle Bell to Action for Animals. It's nice to see you, Dr. Bell.
Thank you. It's nice to be here.
What are some of the things you wish owners would do, or pet owners, or pet parents as they call them these days? What are some of the things you wish they would do for their animals?
I have to say that I have a couple pet peeves, so to speak, in seeing patients on a daily basis.
Okay.
There's so many issues about welfare and, proper pet care, but two things that come to mind would be the body condition of the dog, and also how a dog is kept in its home environment. So with the body condition of a dog, it pains me to see a dog that's too skinny, right? But I'm seeing far too many pets that are too fat.
How come?
Because people probably don't realize what a healthy body condition is. So, and the dog just begs for food. They're eating food. The dog is looking at them pitifully. Here, have a treat. Plus the main meals, And then over a period of time, you have, overweight, obesity. And then that, just like in us, it comes with certain, illnesses. Mm-hmm. And we're the ones that are in control, not the dog. The dog isn't opening the fridge. But people talk like if the dog is opening the fridge. Oh, he eats so much. Or he eats his food, and then he eats his brother's food too. But you're in control,
right? Right.
So it is a pet peeve of mine to see pets that are overweight constantly.
Okay. How do you take care of that latter problem, where the one dog eats the other dog's food? How do you work that one out? Do you feed them separate times, away from each other?
Just like what you said.
Oh,
Either
okay.
you separate them, or you just be vigilant. I mean, you're the one in control, so you can stop this dog from going over here and eating the other dog's food. Now, if it's a case where people are busy, you have to find a way.
Yes.
But people are usually aware that one dog is eating another dog's food, and the other dog is probably more passive and will just allow it. Yeah, You
mentioned on your visit, though, you were talking about feeding from the family pot.
Yes.
Yes.
That's okay.
Yeah.
Actually.
I was surprised that you said that.
It's okay. Yeah, you will. Okay, this is my opinion.
Okay.
You will have some vets that say, no, you must not give any people food to the dog. Okay, that's your opinion. I think it's okay. Again, you feed to condition. So if the dog is already well covered, you don't need to give them extra food, all right? Mm-hmm. You don't want to give cooked bones. Those can splinter, those can cause constipation, big problems, surgical problems.
Yes.
And then, you want to feed a balanced diet. So if you're not really able to do the balanced diet with cooked food, it's best to give a commercial ration like dog food in a bag of chow or
Yes.
canned food.
What size bowl or dish? I know I've seen some people feed their dogs from saucepans, but you can get the dishes.
It really doesn't
Depends
matter.
on the size of the dog.
Yeah, I mean, you want the dog to be able to easily get to the food. You don't want a container so small or so light that it flips over.
Yeah.
So you want to have, a size that is going to allow for the dog to easily access the food. If you're feeding commercially, as in a dog chow, usually recommendations are on the back
Yes.
for how much to give for the size of the dog. So that could be a guideline.
Mm-hmm.
But if the dog is already chunky, don't give as much as that.
Right.
Or if the dog is too skinny, give a little bit more. And there's another myth that you can only feed a dog once a day. You can feed a dog twice a day, 3 times a day. It doesn't mean that it's going to be overweight because you're feeding it 2 and 3 times a day. It's the total daily amount that you have to look at.
Ah, just like humans, portion control.
Correct.
Correct. Okay, so what are some of the things? Well, you mentioned, I guess that would fall into the would not do category. Don't overfeed them, don't underfeed them.
Yeah, I guess they merge, right?
Yeah, they merge. They merge. So, is having a pet really that much of a responsibility, or can anyone get a pet?
It is a responsibility. A pet is a life that you're looking after. It's a decision that you've decided to make. So you shouldn't take it lightly. You shouldn't take on the responsibility of a pet if you do not have the time. It does take time.
Mm-hmm.
You have to clean up after them. You have to look and make sure they don't have fleas and ticks. You have to make sure that they're being fed adequately. You have to give them exercise. And if you realistically don't have the time to do those things, don't get a pet. Or don't get 2 and 3,
Yeah.
And
you have to give them love.
Yes, interaction.
Interaction.
It is a decision that people make. I'm going to go and get this pet, or I'm going to purchase this pet.
Mm.
Well, then you need to do your part.
Yeah. Last time when we spoke with Dr. Tremaine and Bakari, they were talking about, knowing the breed that you're interested in and what to expect from that breed.
Yeah.
So that is very critical as well in
Yes.
pet ownership.
Yes, because
Okay, we're going to take a quick break. And when we come back, yes, I know we've touched on it, but we've got a veterinary surgeon here right now. Spaying and neutering. I'm not a stuck record. It is very, very critical. And not only that, for your pet's health as well. How? We'll find out when we come back. Over the past weeks, we've been talking about the importance of spaying and neutering, but this is for dogs and for cats. However, Dr. Bell, there's a health reason as well, not just for preventing them from reproducing.
correct. Reproductive cancers and certain diseases, like in males, you can have prostatic disease when they're not neutered.
Mm. And also behavioral problems as well.
Yes, you can have males that are frustrated trying to get out at females that are in heat in the neighborhood, constantly escaping. And by their escape, then they can become poisoned, hit by a car, etc.
Yeah. Okay, so spaying and neutering is very important. And when should they be spayed? How old?
In a normal situation, 6 months and older, is what at our clinic we consider adequate. But in a shelter situation, when, like for instance with the RSPCA, if they're going to rehome a puppy or a kitten, they would want to make sure that it's neutered early, so that the person isn't promising that they'll bring it back and never bring back their
Yes,
pet.
Charmaine Hatcher mentioned that.
Yes. But generally,
Yeah.
we like to wait until they're at least 6 months.
Right. And
Yeah.
with the females and spaying, how soon after a heat or before a heat should you do that?
You would want to wait at least 6 weeks after a heat,
Ah, okay.
because you usually have a 6-month window between heats, usually.
Usually.
But you want to make sure that heat is completely cleared before they're spayed.
Okay. Let's talk about housing, where we keep them, and also exercise.
Okay.
How important is it?
Exercise is important for the dog's mental health, for their development as well. I have seen it with my own eyes, keeping puppies in a very small enclosure, not being able to actually run around a bit and use their muscles adequately. They have conformational, disorders. And they don't look, like their legs don't look right.
Oh.
They don't have that muscle. Imagine if it was us.
Right,
Not
right.
able to walk around much. You're not going to have much muscle. So then, their conformation wouldn't be right. So it's just unhealthy to have them constantly in a small enclosure, and it's inhumane.
Yeah, and some of the enclosures as well are rather hot in the summer.
Correct.
And not enough ventilation.
Correct.
All right. What about socialization for animals?
Yes, I have seen some unfortunate cases of, the dog is just throwing the food and it doesn't have any human interaction. That's, inhumane once again, because they need socialization just like we do. And if it's not with humans, it needs to be with dogs of their own kind at least.
Mm-hmm. So we move on now to some of your emergencies. What do you see as a Caribbean vet? We mentioned summer, heat perhaps might play a part.
Yeah.
How much water to give, how much water not to give. Can you give too much water? Because I know they talk about with humans sometimes you can overdo it. So is that a problem?
No, you want to always provide a great quantity of water, and they will go at it as they need to. You want to make sure the water is clean. You change it at least once a day, and that it's not somewhere that is going to be just boiling hot when the sun is beating down. So you can't give the pet too much water because they're going to drink what they need.
Mm-hmm.
The problem is if you don't provide the water,
Right.
then if they need water to cool down or to hydrate themselves, it's not there.
Mm-hmm. So when it comes to us, what do we look out for if the dogs have been compromised? If, say, they're dehydrated or if heat stroke is coming on?
Yeah, so you can have something called heat stress or heat stroke. Dogs like bull mastiffs, Rottweilers, Akitas as well. Large breed dogs usually, but any dog can suffer from heat stress. And that can be, it may not be any fault of the owner. It can be the dog is just running up and down along a fence, for instance, agitated at people passing by. And it's the ambient temperature is high, then they can develop a heat stress. So the signs you would see would be like salivating, a lot of frothing and a lot of saliva dripping, panting heavily. You'll see in like American bulldogs and those kind of breeds, you'll see that their tongue is very red and their eyes are very red.
Oh.
The white dogs too, they'll be
Yes.
very pink and red and angry looking. But the excessive panting and the over salivation, those are the first symptoms, but then it can progress to seizures.
Wow.
So if you suspect your dog is too hot or heat stressed, take a hose and wet them down and put them in a cool location. And then maybe you can prevent it from going to the next level, which is where they need a veterinary intervention, because it can lead to death.
Yeah, the organs start to shut down,
Yes.
we were told. Also, you can put a fan on them as well to help cool them down.
Yes.
The importance, Dr. Bell, of vaccinations. Now, last week we were talking about the puppy mills and so on, and they might not give you a puppy who's been vaccinated. How often? I think you did mention it in the visit, but I think it bears repeating.
So they're usually a course of 3 vaccines as a puppy, and then it's repeated annually. So that's the general recommendation,
Okay,
from about 6 to 8 weeks of age.
6 to 8 weeks. Okay.
Mhm.
Now, I get met all the time by people who watch the program and they enjoy the information shared. One particular viewer did say, well, you know, how come you can't dot the tails and crop the ears anymore? It doesn't really hurt them, you know, or so it seems.
Yes. Docking of tails and cropping of ears is considered a cosmetic mutilation, and it's something that humans decided to do because that's what they wanted the dogs to look like. And if you think about it, who are we to do that to an animal just because we like how it looks? I mean, it is done in certain instances for working dogs. You know, the tail might get in the way or something like that. I totally understand that. But just because it's cosmetic, and then it does cause the animal pain, and then you can have post-operative complications. You can have infections, you can have chronic pain. I've seen cases where ears have been cropped and it was just done horribly and
Wow.
painful and infected. The Barbados Veterinary Association, we don't agree with tail docking and ear cropping.
Right. So if you see it, you know, here on the island, you know that it wasn't done by a vet here on the island, following the United Kingdom rules and regulations as well with their kennels and
Correct.
proper breeding. And then there was another viewer who, not cats or dogs this time, I think she had a bird and she was wondering, is it okay to clip their wings?
It's okay to clip a bird's wings. It's not actually painful for the bird. It's just like clipping nails.
Oh, okay.
And, you know, you do that to prevent the bird from flying away, you know.
Right.
So, I mean, in the case of a bird that's a pet,
Yeah, yeah. I
So-
think her bird was a pet.
it's actually not painful for the
inside
bird.
the house.
They may not want you to hold them. The restraint,
I
they may
didn't
not
realize
like
it was a thing.
Yes.
You know, because if you have a cat, sure you're putting the bird at risk. You know, because it can't escape.
Yeah.
But what would you like us to take away today? Because time has disappeared from us. What would you like us to take away?
I would like, generally, if you want to be a pet owner, that's lovely. Just research what you need to provide and make sure that you can provide those things and that you have the time to provide those things, because it's a responsibility, it's a life. It's not just a thing in the yard. It is a life that deserves to be treated with the respect of being a sentient being.
Yes, yes. And, you know, most of us consider ourselves Christians, and we do believe that, you know, God put us in care of the animals here on earth. So this is just one way that we do it. We do it correctly. Thank you so much for joining us. Thank you for joining us, Dr. Bell.